My doctor prescribed me a 3-phase rehab program for my lower back, and this is phase 2. Exercises, phase 2. Perform 10 reps of each exercise in order, and then repeat the entire cycle for a total of 3 sets with minimal rest between exercises. Lying ab march. Lie face up on the ground, knees bent, feet on the ground with a small towel rolled under your lower back. Tighten your abs, pressing gently into the towel under you. Lift one foot slightly off the ground and hold for 5 seconds. Alternate sides in a marching fashion. 1 rep is both legs. Add time to each hold up to 10 seconds to make the exercise more challenging. Side lying hip abduction. Lie on your side with your top leg straight and your top hip rolled forward. Lift your top leg in the air, leading with your heel. Hold for 5 seconds and then slowly lower it. Use an elastic band if you want to increase difficulty. Glute bridge with hold. Lie face up on the ground, knees bent about 60 degrees with your feet hip width apart and on the ground. Lift your hips off the floor, squeezing your glutes. Hold for 5 seconds. Do not overextend your back. You should feel the activity mostly in your legs. If you feel strain in your lower back, lower your hips a bit until you feel your legs take control. Add time to each hold up to 20 seconds to make the exercise more challenging. Crunch. Lie face up on the ground, knees bent about 60 degrees, your feet hip width apart and hands gently touching the back of the head. Slowly lift your head and chest until your shoulder blades are off the ground. Squeeze your abs as you lift. Hold for 3 seconds. Add time to each hold up to 10 seconds to make the exercise more challenging. Plank, knees down. Lie face down, propped on your forearms with your elbows under your shoulders and both knees bent. Lift your hips off the ground, creating a bridge from your forearms to your knees. Keep your abs tight and your back flat. Hold for 30 seconds. To make the exercise more challenging, bridge your forearms to toes, lifting your knees off the ground. However, don't try this unless you can keep a tight ab, flat back, straight position. Phase 2, cardio. Do some kind of low impact cardio activity 20 to 30 minutes per day for at least 3 days a week, and then 5 days a week as it becomes easier. As a general rule, don't increase the volume or intensity of your cardio exercises more than 10% per week. The key is low impact activity that doesn't cause pain in your back. When you proceed to low impact running, do so for no more than 3 days a week with a day of rest between. If you want to do cardio exercise 5 days a week, then bike or swim for the other 2 days. If your back pain increases, scale back the running to 1 to 2 days a week at a lower intensity. You may use a bike or pool for the remainder of your training days. If pain continues, see your healthcare provider. Stretches, phase 2. Perform 2 to 3 reps of each stretch in the order listed. Hold the stretch for 30 to 60 seconds and taking a brief rest between reps. Self-massage, glute. Sit upright on the floor with a tennis ball, foam roller, or similar object under one side of your glute muscle. Support your body weight with your arms and legs moving up, down, and around the glute muscle. Give extra attention in the muscles that feel sore. Repeat both sides. To make the stretch more challenging, try crossing the leg over the opposite knee. Kneeling quad hip stretch. Kneel on the ground with one knee resting on a towel or foam pad and the other knee bent with a foot in front of you. Tighten your abs, squeeze your glutes, and press your hips and torso forward. You should feel a stretch in the front of your lower thigh. If you feel pain in your lower back, shift your hips back, retighten your abs, and try the stretch again. Repeat both sides. To make the stretch more challenging, place your back foot up against a wall or chair. Lying glute stretch. Lying face up on the ground with both knees bent, cross one leg over the other, resting the ankle on the opposite knee. Keeping your back flat, grab your thigh with your arms and pull it towards your chest. Repeat both sides. Lying hamstring stretch. Lying face up on the ground Grab the back of your thigh or loop a towel around the foot of your injured leg. Keeping a slight bend in the knee, slowly lift your injured leg into the air using your arms or a towel for support. You should feel a stretch in the back of the thigh of your raised leg. Repeat on both sides. Cat camel stretch. Crouch down on the floor on your hands and knees. Round your back toward the sky and rotate your head down towards your chest. Hold for 3 seconds. Slightly lower past the start position, curving your back with your stomach towards the floor, your butt up and your head lifted to the sky. Hold and repeat. I just completed phase 2 and I'm feeling great. Now it's time to move on to phase 3.